Okay, everyone. My name is Victoria Saucedo. I am the current Chief Financial Officer and Treasurer for the Judy Nicholson Foundation. And tonight, this is our Young Voices on Kidney Cancer panel that we are hosting for the month of March. We are excited to welcome everyone tonight to our panel. And we'd especially like to extend a thank you to our two sponsors for tonight, which is Merck Pharmaceuticals and Exelixis. They provide a lot of support for our foundation that allows us to host educational programs like this panel tonight. For our next question, it regards the topic of parenthood and navigating that alongside kidney cancer. So whether you're currently navigating parenthood or you've had to deal with the questions regarding family planning in the future around your diagnosis, we know that kidney cancer does add an extra layer of complexity. So this question's for everyone. And Sid, if you would kick us off and just share a little bit about what being a young parent facing kidney cancer is like and how you've navigated those challenges of balancing treatment and recovery along with the demands of raising children.
I would say I'm still navigating those feelings very much. As much as I would love to say I am an expert on that, I would say I am very much still learning on how to navigate a lot of those feelings. So yeah, I think as I mentioned earlier, my wife and I were planning on trying for a kiddo in December of 2023, and that's when I was diagnosed. And I think when you hear the word cancer, you just automatically, as Anna Maria was saying, you just have all these contemplations of what that is and what that isn't. And it's like, oh, we can't have kids. You can't have kids. And I remember distinctly having this conversation with my wife about, and for those of you, my wife is a nurse practitioner, and really from when I was diagnosed, she was very much, we're just going to get this out of you and just move on with life. And I was like, I wish I could have that attitude. I did not. And so with me, I think after we found out that my wife was pregnant, it was a little bit different because there was such a whiplash effect from going from one end of the worst thing that's probably ever in my life to then maybe the best thing that's ever happened in my life. So there was a very strong whiplash, is how I would describe it, going from that to the other. And I think, and I also had a therapist before my diagnosis, so we're delving a little bit into the mental health side of things here with being a young parent. I talked a lot about that with my therapist, with Rachel as well, my wife, who was very understanding of kind of the feelings that I was having. And also the fears, right? I think I just went through this diagnosis. My doctors are very optimistic. I'm just like, what if this comes back like a year from now? And I just had a kid now we have a 2-year-old. What am I doing here? So all of that is to say that there are a lot of big feelings there that I'm still currently digesting, but for advice purposes and how I would say going about those, whether or not you are planning on having a child or you already have children, I think one of the biggest things that has helped me navigate a lot of these feelings since we found out that we were having a child was seeing that life in a weird way does move on post-diagnosis. And I don't know if that's 100% a good thing or 100% a bad thing, but for me, it's helped me be that it's cliche to say, but as a chapter, as like that was a chapter and now I have this chapter, and it's helped me a little bit continue to move on. It's still very fresh in my mind because it's just now a year and some change since my diagnosis and surgery. Our child was born not even a year from my surgery. So it was very much a quick turnaround. So all of that is to say that I'm still freshly working on a lot of those feelings. I'm sure others here will have some great insight as well.
Yeah. So for me, I don't have any children, but very similar kind of to Sid, I was planning to have kids when I was diagnosed. I was actually going through the final diagnostics after I had been dismissed for a year and a half. I was going through pursuing new primary care physicians and everything to try to make sure that it'd be safe for me to have kids. And that's when we ended up finding the cancer was in that time period. And so for me, that was a very big shift. My husband and I got married just 2 months before I was diagnosed. So going from picking out baby rooms to picking out cancer centers is a whiplash. It is really difficult to try to navigate and then also to try to come back from. For me, especially due to the rarity of what I had, I don't feel comfortable having children, but that's just a personal choice. And maybe one that I change down the road as far as looking into fostering or adopting or something like that in the future. But because I was stage 4 at diagnosis and had such a large tumor burden, I don't think it was anywhere in the mind of any of my physicians to have that conversation. So there was no fertility preservation treatment I was on. Technically, you can have kids. I believe it's after 4 months, you can try to get pregnant. But there's so many unknowns. There's so few people that have been on that medication at my age that for me, I went from this world where I was picturing what life would have been and raising a family and kids. And all my friends, my best friend of over 20 years actually told me she was pregnant the day that I was telling her I was moving down to Texas to move down to MD Anderson. And so there's this separation of worlds that I think came from me because I didn't end up having kids. So for me, that new chapter wasn't the chapter that I was pitching or envisioning before I was diagnosed, but also I couldn't even begin to imagine the joy that I have in life now and the gratitude that I have for the things that I'm doing now. So for me, that was a shift. And so I'm not there mentally to think about those things where I'm currently we've just decided not to have children. But that's how those conversations have shaped for me being diagnosed. So yeah.
My conversations were similar with my husband. We went from being 30 and recently married to have a stage 3 cancer diagnosis. And then it came back. The next year was mets to my lymph nodes. So those conversations were more so, what will we do if we can't have a baby? So we did the IVF before I started immunotherapy, which was all me advocating for myself, since that wasn't really brought to the table until I brought it to my oncologist and I wanted our family in the future and what were my options for fertility planning. But our conversations turn into, what if I can't? Do we adopt? What are our options? So it's like very deep conversations. And my husband's been my support, my partner. He's so thankful for everything he's done. I was just open with my oncologist throughout the whole treatment. So we decided that after my treatment was done in February, I had the green light to do an embryo transfer in May. I actually was naturally pregnant in April and had my son in December of 2023. So we were lucky to have that. But of course, it's always in the back of your head. What if it comes back? What are things like that? So anxiety never really goes away. I did the genetic testing. I know mine's not genetic as far as the research that's out there right now says it is not. It's just hard. It really changes your whole mindset, especially when you're so young, because it's not really something you think you're starting your family and you're starting your life with your husband, and cancer just throws you for a curveball. Obviously, my son's 15 months. He doesn't really know any of the situations yet. I know there's books out there and resources. I think Chelsea Gomez read a really good book to introduce kids to the idea of my mom has cancer, if anything like that happens. So I know there are resources like that to depend on, but it just throws you for a curveball. But I'm happy. I'm so grateful for my son. It took a lot of work to get here. I went through the cancer and then I got to NED and then had him. So hopefully, obviously, everything keeps going well and maybe more kids in the future. We're not really sure yet. Got our hands full with one, but really just advocate for yourself. I know at our age, it's not something they're thinking about in their treatment plans.
So I kind of bridged these experiences. So as I said, my son was 5 when I was diagnosed. So he was still very young and it was very traumatic for him. And so very quickly, I try to find him therapy. Wonders and Worries is a group down here in Texas that provides free one-on-one and group services to kids whose parents have or had cancer. And so I got him in sessions with that. And I'm saying this all for a reason, right? And then through that, I got him connected to KETSM, which is a camp and year-round programs for children whose parents had and had cancer. And he's still in that. And he still goes to that. It's been hard. It's still hard to parent when you're a young person with cancer, because you can't stop feeling guilty for making your son scared, for making your kids scared. And I'm going to cry because this is one of those things that I do cry about. There was one time where he was screaming for me. He didn't know where I was. And like in his mind, I was dead. And I was like after the first time. And he told me a couple of years ago when I had the thyroid cancer that he follows me around because he wants to spend as much time with me as he can because he doesn't know if I'm going to live. And maybe if I didn't get thyroid cancer, it'd be a different story at this point. But with all the different health things that's come after that, there is no guarantee for me. I can't guarantee that there will be something that will happen that will make it impossible for me to see my son grow up. And so I know I'm 42, so I'm technically aging out of the young, but even at 42, my son's going to be 10, which I don't even know how that happened. I don't know how he grew up. I don't know where that even occurred, but he's going to be 10. And so that's like in 8 years, he's going to graduate high school. And before I turned 40, I thought I was done with cancer, and then I wasn't. And then before I turned 42, sorry, I'm not 43 yet. Before I turned 42, I thought I was done with cancer, and I'm not, right? Like it might have been precancerous, but it's still something I have to watch out for. And I have to pray that doesn't happen again and come back again. So it's just this constant idea in the back of your mind that, am I going to see my kid grow up? Am I going to see him turn 40? Am I going to see him turn 42? Sorry, it is something that I don't talk a lot about. I do. I don't. I can't talk about it without crying. So I'm sorry. It's a pattern we're supposed to be raised. I think, too, at the time I was diagnosed, my partner and I were talking about possibly having our own kid. And I know very quickly said, no, not at your age and not with one kidney. And I'm like, oh, I won't be able to have a child. And then a year or so later, it was like, oh, that was incorrect. Should have never told you that. You could totally have a kid with one kidney. I'm like, at this point, it's a little like too late. I had radioactive iodine. I have no idea what that's done to my fertility. I think one thing people didn't talk about a lot when it comes to that fertility conversation is when you are not able to have a child, or your ability to have a child is in question, you can feel less like a woman. And I'm obviously a cis woman, right? Like obviously in that way, but you can feel like your womanhood was taken away from you. And so that was something I think I've struggled with over the last 5 years. At this point, it's like, it wouldn't make sense to naturally have a second child. It makes me like sometimes feel really bad. I'm like, oh, not only did I fail as a woman because I got kidney cancer and I didn't get a woman cancer, like now I can't have, which I think is another subject that we totally needs to be talked about. But now it's, oh, now I can't have, like now my body is failing me in all these different ways. And I'm going to go off camera and explain myself. So I'm really sorry for crying.
All is good. Thank you so much for everyone for sharing that about parenthood. I really appreciate it.